I'm going to demonstrate how to do a cold compress. Reasons that we would do a cold compress would be for pain and inflammation or swelling. Supplies that you would need: cold compress and a towel. We're going to start with our beginning procedures. Go into the room, identify the patient, identify ourselves, check the wristband. This is Mrs. Jones. We're going to ask any visitors that are there to leave, provide privacy, wash our hands, of course, before we start the procedure, explain that we're going to be placing a cold compress, which we're going to do on her left shoulder, answer any questions that she might have, and allow her to assist as needed. I am going to raise the bed rail on the opposite side. Raise the bed to a comfortable working height, which is the last thing in my beginning procedures. With a cold compress, we want to make sure that we never apply it directly to the skin, that we always have a barrier like a towel. Mrs. Jones, I'm going to put a cold compress on your shoulder. So we'll undo the gown, only exposing the area where the cold compress is going to be placed. Here's the compress, and I'm going to place it inside a towel. It's very important that when we put this on the skin that we assess the skin first for redness, anything unusual that we'd want to report to the nurse. So we've assessed the skin. Now we'll place the cold compress on the shoulder, checking it every 5 minutes. And when we check, again, we're lifting it up and we're assessing for anything unusual, and then removing it after 20 minutes. Now it's gone 20 minutes, and we're going to remove the compress. Assess the skin. If there's been any moisture, we're going to dry that off. Do Mrs. Jones' gown back up. And then do our ending procedures, asking Mrs. Jones if there's anything else we can get her. Make sure the call light is within reach. She has water. She's comfortable. We want to do an overall safety check. Lower the bed to the lowest position. Put down the side rails. Ask the visitors to come back in.